Hello, I'm José Ferrer Costa. I'm a medical doctor and a PhD researcher at the Universitat Oberta de Catalunya. I also work at Badalona Serveis Assistencials, a public healthcare institution in the Barcelona area, where I coordinate research and innovation projects focused on the use of extended reality in healthcare. I recently published the paper Enhancing the Predictive Value of Formative Evaluation in Extended Reality Adoption, Addressing the Experience Gap in JMIR Formative Research. This paper comes from a practical problem we have seen in our clinical innovation projects. Before introducing a new technology in healthcare, we usually ask clinicians and the healthcare team to identify the possible barriers and facilitators for implementation and adoption. Their perspective is essential because they understand the real workflow, the patients, the safety concerns, and the organizational constraints. But with extended reality, or XR, including virtual, mixed, or augmented realities, there is a specific limitation. Clinicians are often asked to evaluate the implementation of these tools before they have had any direct experience with them. In practice, they may be evaluating the preconceptions, expectations, or uncertainty about the technology rather than the real experience of using it themselves. This is what we describe as the experience gap. In XR, aspects such as comfort, presence, interaction, spatial requirements, supervision, and patient tolerance, and also workflow disruption are difficult to judge only in theory. They become much more clear and when professionals actually try the tool. Our paper argues that brief hands-on familiarization before structured formative evaluation can make these assessments more realistic and useful. The aim is not to promote XR for every clinical setting, but to help organizations make better decisions about when it is appropriate, what conditions are needed, and what barriers should be addressed before implementation. We have chose JMIR publications because since our institutions entered the field of clinical XR research years ago, we have always considered JMIR a reference point in digital health. We value the clarity, the methodological quality, and the trustworthiness of its publications, especially for work that sits between technology, healthcare, practice, and implementation. For us, JMIR formative research was a very good fit because this paper is not only about the technology, it is about how healthcare professionals and organizations can make better decisions before investing time, resources, and clinical effort into immersive tools. I hope this work helps other teams move beyond the initial enthusiasm for XR and toward a more grounded, experience-based decisions about how these technologies can be responsibly adopted in healthcare.